Thank you, Dr. Kim. I'd like to present a little bit about human cardiac anatomy and introduce how you can examine heart specimen today. I thought, what's the good name for this kind of activity? I found the hearts on hands is good. Hearts on fingertip, or hearts in the heart, or hearts in the head. That's different. We have to have our imagination of a heart in our brain, but also in my heart, we should have a heartfelt feeling of patient, but also we should have very skillful. So heart on hand is our title. So we have a heart on hand center. As you can see, in each table there is a board panel with this kind of picture. So this will be printed out and distributed to individual tomorrow. Sorry for that. We prepared a little late, so it will be distributed to tomorrow. So you don't have to worry about the recording of these things. So in this panel, I would like to examine the normal heart, the collection of representative pictures of heart anatomy, and in external and internal anatomy, and heart in sectional anatomy. And also, if you examine closely, it's just reminding you on current understanding on cardiac anatomy. So I don't think you need to get any additional knowledge on it, but you should have to have this kind of feeling through the real heart specimen. So when you examine those heart, you can put those heart from just in front, like looking at the patient for adult and for children, and from right lateral side and from left lateral side, so that you can recognize again how the heart inside is look like. And also, when you open the right ventricle, you can open through the showing both right atrium and right ventricle together, and septal leaflet of tricuspid valve, and orifice of coronary sinus, and Tebesian valve, and eustachian valve together. So this kind of view is possible, and also from this view, it's a frontal view to show the ventricular septal surface by lifting up the anterior free wall of right ventricle. So in this specimen, it looks very clear to have septal superior, inferior, anterior superior, and posterior inferior cusp, leaflet of tricuspid valve. But in reality, is that that's not this classical. There are so many pieces and fragments of valve tissue. And also from the left side, we can recognize the mitral valve is very thin, and also membranous septum is very thin. So we can see from the left side by illuminating the other side of the heart to show the thinness of this cardiac tissue. And also there are different viewpoints of the heart, so that we can look at the membranous septum like you open the infundibulum of the right ventricle from the frontal view. And also we can dissect the muscle directions in this way, so that in the immediate subendocardium there is some kind of disarrangement, but after with dissecting more, it goes to front horizontal. So that's a mixture of different direction of a heart specimen, but there are some rules to have this anatomy very consistent and very useful functionally and anatomically. And also coronary artery anatomy can be visualized in this way by filling this coronary artery by silicone cast, and remove some of the fatty tissue outside of the vessel. This specimen also you can see through the real specimen today. And also, those sectional anatomy is very useful for echocardiography and MR images, but you can also recognize it directly through this specimen. And also for chamber view and personal long axis view. And also by surgeon's view, you can see after opening the pericardium, you can recognize superior caval vein and right pulmonary vein from the right side. And you can also recognize the sulcus terminalis and the location of the sinus node and aorta and this kind of different structures in nearby structures. And also by dissecting Waterston groove, we can show the bilayer of the atrial wall surrounding the oval fossa so that we can split off to make more space to the left atrium, like in this way. This is to expose the aortic valve. And also from the right atriotomy, we can see membranous septum and coronary sinus in this anatomical location. And also nowadays, we have more concern about arrhythmia. So anatomy on arrhythmia is also very related to anatomy of congenital heart disease. So we have this kind of panels to be distributed to you tomorrow. So if I summarize the anatomical principle, we have the very peculiar morphology. So morphological basis is a basic infrastructure of our understanding, but also we can add some developmental concept, and also, but more importantly, clinical pathologic and clinical experience will add your current understanding to be more useful to your clinical practice. So, and step-by-step analysis and common and rare conditions, and sometimes you may imagine some hypothetical anatomical fact, but it can be proof or unproof by studying in detailed examination, clinical or anatomical examination. We have this kind of panel. So we have 8 groups. So each group has this panel. This panel was used for Asian Society Cardiac Surgery meeting in March in Seoul. But as you can recognize, we have 10 heart specimens in each group. But I added at least 5 specimens in each group. So there are 10 specimens among this list, but 5 additionals are in each table. So table 1 has VSD and ASD, table 2 has TGA, and table 3 has AVSD, table 4 has DYLV, and table 5 has TOF, table 6 has corrected TGA, and PAIVS, and the last group is very complicated group. So there are so many hypoplastic left heart syndrome specimen, isomerism, and anomalous pulmonary venous connection. So there are too many specimens in each group, but just enjoy. And when you see the heart case, you can recognize the blue color number. Big number 3 means 3 for 3 is AVSD, group 3, and group 5 is TOF. And also there are small numbers, 36, 557. That means among group 5, there are 10 specimens in the panel. And then this is number 7 specimen in the panel. So you can recognize the in the panel on the diagnosis. You can also recognize the QR code in the bottle, in the box, or in the panel. That is for your QR code scanning for YouTube watch video on this particular heart. It is in Korean, but I don't think you can. You still understand because most of the medical terminology is in English. So if you I'm sorry, the Wi-Fi is not available in this room. So you can do it in the hotel, this particular area is a kind of a restricted area for a postcard company. So there's nobody coming, and so it's very free for our this kind of secret activity. So that's the cost for your inconvenience and elevator usage and so on. So, and also there are the individual number tag on individual heart, but some of them may be damaged, and also there are the diagnosis in the cage, but the diagnosis may be wrong. In that case, please report to our staff, because we have a printing device in this room, so it's better to correct today after you report. This is how we can examine, but I'd like to introduce a little bit about Heart and Hand Center, which is located in the exhibition hall of the convention from tomorrow and Saturday. So there will be all of these specimens, and additional adult specimen will be available at the exhibition hall, which is the in-between adult conference hall and children pediatric conference hall. So that there you can still examine this specimen tomorrow and the day after tomorrow. And also there will be small lectures at the Hearts and Hand Center in the afternoon, so you can participate. But more importantly, you can join your lecture and discussion session in your own room. This is the myocardial infarct, valve disease, and dilated cardiomyopathy, hypertrophic cardiomyopathy, myocarditis, aortic aneurysm, and so on. In this room, we have a screen, and this is number 1, 2, 3, 4, 5, 6, 7, 8. So hearts are fixed, and human moves and rotate. So as I said you before, you'd better keep your bags behind the seat so that we can, when you move, you don't have to carry your bags. And there is nobody around in this room, so you don't worry about losing your belongings. And so after group 1, 2, 3, 4, 5, 6, this is the direction of your rotation. We have 3 sessions, C1, C2, C3 for heart specimen observation. The first session is immediately after this session. From now on, you can start the session C1, which is 2 hours and 30 minutes. And during this time, you will examine 4 groups. That means the first group for 40 minutes, 40 minutes, 30 minutes, 30 minutes. So, and the C2, 30, 40, and so on. So you have 8 groups to review, not all, but most of the specimen today. It means that you have to finish this table in 40 minutes. So, and also there is one additional box containing 3 normal heart in each table. So number 7 in red color is a normal heart box available in every table. And also, and so during 30 or 40 minutes, you have to examine 15 heart. That means 1 heart for 2 minutes. I don't think it's possible, but it may be possible if you examine yours and share with others. So after your examination, you can explain to your friend this specimen is like this and share like that way. And also, there are group leaders in each group, so following and listening his examination is another idea. The other is a busking lecture. You know what is busking? So busking space is here. So whenever you find something valuable, you just come and explain through the camera, live video camera. So, and last year we have many people came to explain the heart specimen. So you are very much encouraged to come and to explain what you see. The rest of them don't have to concentrate his speech. Just you examine your heart, and in your ears you listen the busking presentation. And as I explained already, you have more time and more heart on tomorrow and day after tomorrow at Hearts on Hand Center in Exhibition Hall. So you can examine today, and if you think an additional examination is necessary, you can come again to Exhibition Hall to review this specimen again. So from now on, for 40 minutes, you have to finish each group. And then after 40 minutes, you move to next group, and so on. Any questions? So I will briefly start first busking by explaining human heart anatomy here. So you just keep your heart specimen, and also, the last slide is this. Protect ourselves. Use apron, gloves, and arm protector on your table to keep your fingers dry and soft. And also, heart will be hurty, but don't hurt too much. So heart is we have washed in formalin flavor in water, but still a particular big heart will smell formalin. So, but this room is high, so that it is less smelly than before. Please enjoy it.